Unit 11 Respiratory System Questions. The nurse is developing a plan of care for a client at risk for acute respiratory distress syndrome. The nurse includes in the plan of care to assess for early signs of this disorder by monitoring the client for 1. Dyspnea, 2. Frothy sputum, 3. Diminished breath sound, 4. Edema. The correct answer is 1. Dyspnea. The emergency room nurse is monitoring a client who was treated for an asthma attack. The nurse would determine that the client's respiratory status had worsened if which of the following were noted on assessment. 1. Diminished breath sound, 2. Wheezing during inhalation, 3. Wheezing during exhalation, 4. Wheezing throughout the lung fields. The correct answer is 1. Diminished breath sounds. A client arrives in the emergency room with a bloody nose. The initial nursing action is to 1. Place the client in supine position, 2. Apply an ice collar around the client's neck, 3. Assist the client to a sitting position with the head tilted forward, 4. Instruct the client to swallow the blood until the bleeding can be controlled. The correct answer is 3. Assist the client to a sitting position with the head tilted forward. The nurse is performing an assessment on a client who was admitted to the hospital with a diagnosis of carbon monoxide poisoning. Which of the following assessments performed by the nurse primarily would elicit data related to a deterioration of the client's condition? 1. Skin color, 2. apical rate, 3. respiratory rate, 4. level of consciousness. The correct answer is 4. level of consciousness. The nursing instructor is observing a nursing student suctioning fluids from a client through a tracheostomy tube. Which observation by the nursing instructor would indicate an inappropriate action? 1. Hyperventilating the client with 100% oxygen before suctioning. 2. Applying suction intermittently during withdrawal of the catheter. 3. Suctioning secretions from the client every hour. 4. Applying suction only during withdrawal of the catheter. The correct answer is 3. Suctioning secretions from the client every hour. The nurse is reinforcing instructions to a client about diaphragmatic breathing. The nurse tells the client that this technique is helpful because in normal respiration, as the diaphragm contracts, it 1. moves downward and out, 2. moves up and inward, 3. makes the thoracic cage smaller, 4. aids in exhalation. The correct answer is 1. moves downward and out. The nurse provides instruction to a client following total laryngectomy. Which statement by the client indicates a need for further instructions? 1. Soap should be avoided near the stoma. 2. I should use diluted alcohol on the stoma to clean it. 3. I should apply a thin layer of petroleum to the skin surrounding the stoma. 4. I need to protect the stoma from water. The correct answer is 2. I should use diluted alcohol on the stoma to clean it. The nurse is caring for a client with chronic obstructive pulmonary disease who is receiving aminophylline intravenously. The nurse monitors the serum theophylline level and concludes that the medication dosage may need to be increased if which of the following results were noted? 1. 5 mg per ml, 2. 10 mg per ml, 3. 15 mg per ml, 4. 20 mg per ml. The correct answer is 1. 5 mg per ml. The nurse is changing the tracheostomy ties on a client with a tracheostomy and is assessing the security of the ties. What method is used to ensure that the ties are not placed too tightly? The nurse places 2 fingers between the tie and the neck. The tracheotomy can be pulled slightly away from the neck. 3. The ties leave no marks on the neck. 4. The nurse uses a 12-inch tie that is affixed with velcro tightly. The correct answer is 1. The nurse places 2 fingers between the tie and the neck.